Welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board-certified veterinary dentist, and we come to you every week on Wednesday to provide the veterinarian and the technician team some actionable things that you can use in your practice. And this episode is going to be a recorded episode that we've done in the past, not a podcast that we've recorded or not the Vet Dental Show, but actually some other information for you that we know you're going to enjoy. So sit back, enjoy, and we'll see you at the end of the podcast. If we have a complicated crown fracture, that means that the pulp cavity is exposed. Always those need treatment, whether they are root canal or extraction. If they're caught right away, if the fracture occurs right away, we can sometimes do vital pulp therapy, but that's gone out of favor as well and is really confined to a surgical pulp capping, which is for instances like the base narrow canines that we discussed earlier. So if you have a fracture that's open, wait and see is never an option. Those always need treatment. The pulp exposure itself is painful. The dog's probably not going to show it's painful, but it is painful. The pulp will necrose, and then the bone will get infected and become painful. So that's always treat it yesterday. If you see a pulp cavity exposed, it should be treated yesterday is a good way to remember that. Okay, so your second question, large pulp cavity ever be considered a normal variant if it's repeatable in the same tooth on both sides and the tooth doesn't appear to be discolored, fractured, or does it always indicate non-vitality? And the answer to that, there may be, if it's a subtle change, it may be in part due to positioning of the tube head. So if there's any question about whether that tooth should be viable or not, I would take another slightly different angle and see if it confirms your suspicion that it is indeed enlarged. But if there's no doubt, comparable to the other teeth, those teeth are non-vital and they either need a root canal or extraction. They don't have to have a periapical lucency, but what happens with those teeth is the pulp becomes, with time, and this may not be the case in all the teeth that you extract like that, but with time, that pulp generally becomes a black soup. It's necrotic, and that has loads of inflammatory mediators in there that doesn't requisite infection in order to get out into that periapical bone and destroy the bone. Some of the worst periapical lesions that we see are working dog canines that have discolored teeth that are not picked up by the handler or otherwise, and we see them a couple years down the road, or it doesn't have to necessarily be a working dog, it can be any dog. And they're generally large breeds because they're a little rambunctious, they like to play with their buddies. Those are some of the worst lucencies that we encounter and some of the worst smelling substances that you'll ever encounter once you enter those teeth if you extract them and section them. Pretty interesting. Next time you see that and you are extracting versus referring for a root canal, check that because it may be present and you'll experience that. Not that it's fun to experience, but it's good from a learning standpoint. Not all of them will be like that because they're all in varying stages of undergoing maybe chronic pulpitis, which is slow and progressive in some cases, and they may not have reached that stage yet, or they may never. They may just stay chronically inflamed, but still those teeth need to come out and they will indeed result in problems or are currently resulting in problems at that point. I got off on a little tangent there. If they've got chronic pulpitis, your pulp canal is going to be the same size as the other one, so you won't see a change there. But from the standpoint of discolored teeth and what we do with discolored teeth, that plays a huge role. If they're extrinsically stained, that's a different story. Extrinsic staining is from cage biting or something else that's abrading the tooth that's causing discoloration. But if it's intrinsically stained, if it's purplish, pink, black, gray, that means the pulp is either dead or dying. If it is dead, you may see a change in pulp cavity diameter depending on how long it's been dead. If it is dying, you will not see a pulp cavity diameter change. You guys have you have this Q&A as a recording, and you can always go back to this as well as a good reference, because we get into a lot of things that we don't dive into in that particular case. We may hit it on another case later in the series, but this is as good a time as any to talk about things like that as they cross this old man's mind. Sometimes I think about something and think it's important that you guys know it on point, but sometimes it's not. So hopefully that's okay with you. I trust you enjoyed that episode. We enjoyed providing it. Take care. We'll see you next week.